We also have to be mindful that, I've had a lot of directors too. I don't worry about the standard. It's not regulatory. Yeah, but what they forget is that the accreditation agencies, including Joint Commission, who are basically there, to make sure you're doing things properly so you can do business with CMS, right? The Center for Medicaid Services and Medicare Services. And also OSHA, right? Under the OSHA Act of 1970 are concerned with workplace safety. So both of those really important organizations, and obviously OSHA being regulatory, they can come in and fine you and do all kinds of other things. Joint Commission and accreditation can prevent you from billing and getting paid for services. So those are two really important organizations and regulatory standards that are driven by the ANSI standard.
Clock in, scrub up, and join us behind the red line. You're listening to First Case, a perioperative podcast bringing you exciting interviews, engaging discussions, and innovative solutions that are changing the way patients receive surgical care. Each episode, we talk to frontline staff, perioperative leadership, and nursing entrepreneurs from across the country as they share their stories, experience, and expertise on the industry we love. From the back table to the boardroom, from wheels in to wheels out, we tackle the real-life issues affecting the OR. Whether you're tuning in for surgical service education or inspiration, we're glad you're here. And now it's time to roll back and start the first case.
On this episode of First Case, we speak with Richard Gama, Director of Laser Safety at Agiliti, and this is an important topic we're going to be getting into today. But also, I almost feel like, as we talked with Richard, that he could have his own radio show, Paul. So this is going to be one easy listening and information-packed interview today.
He really is very knowledgeable about laser safety and the laser safety committee and all the other issues that the hospitals seem to forget about. When I go into a lot of the hospitals where I'm doing consulting work, they have kind of let go of a lot of the issues associated with managing lasers. And I think that what he is going to be able to provide for us is a reminder of all the things that are important aspects of laser safety and care in the operating room.
All right, we're going to be right back after a short break with Richard Gama, Director of Laser Safety at Agiliti.
Hi, I'm Paul Wafer.
I'm Melanie Perry.
And I'm Justin Poulin.
A 17 Studios production, you're listening to First Case.
Joining us now is Richard Gama, Director of Laser Safety at Agiliti, and this is a topic that somehow we have not managed to cover here on the First Case podcast we're well into our second year. So, Richard, this is something that came up actually recently when we interviewed a colleague of yours, Michael Matthews.
Yes.
And we were looking for other great topics, especially around safety. One area that we've been exploring, even as we look at doing virtual conferences, now that we've got our first one under the books, is topics around employee safety and or patient safety. And so this is right in that wheelhouse. And I wanted to thank you so much for coming on the show today.
Absolutely. My pleasure. You hit on a couple of real key points there with the patient safety and the healthcare personnel or worker safety, that both are really important when it comes to lasers and the hazardous energy that they produce.
So, Richard, why don't we just let everybody know you a little bit, your background. But honestly, even if you want to tell us a little bit, something about yourself that's a passion or that you do away from healthcare, just something interesting, certainly share that as well.
Well, thanks. I mean, I've always liked to play hard and work hard. And, certainly patient safety has always been a big part of my career, starting off as a surgical technologist back in 1983. I got into lasers through that position, but I started working as a professional staffing scrub tech, where I got introduced to a company that was very new out there bringing lasers into the operating room. When I started working with them, I noticed they needed a lot of help with their OR protocol skills and sterile, procedures and all these kind of things. So that's how I sort of got into it. They asked me to come work for them to help them out, getting their salespeople and all the people coming into the OR line. And I really got blasted off into the laser world back in 1989, really is when I started going full tilt that way. So I am a surgical technologist by trade. And like I said, that's how I got into the laser side of the industry. And I just continued to work and expand my knowledge, my training, and started teaching others, including other laser operators, got into physician training and a whole world of education and training in that line. All the while I was still doing cases, still on the front lines, doing all kinds of different laser cases and whatnot throughout, mainly California. Then I started branching out all over the place. But it's just always been a desire to learn and get better every day.
Well, we love that, the educational piece from several fronts, educating yourself, staying kind of, current, relevant, or even ahead of the curve, which it sounds like, and then also educating others. And we talk a lot on the show about leadership, and, a big part of leadership is just continuing to contribute to the growth and development of your peers or colleagues, throughout the industry. So you're a good fit for the conversation today. Now let's talk a little bit more about lasers. We've talked about your experience and set the context there, but what makes lasers so different than other types of energy-based technologies? Because, everybody's familiar with all types of energy-based technology, but lasers are a different beast, I guess.
Yeah, absolutely. What really sets them apart, of course, is the fact that they are utilizing radiation. It's non-ionizing radiation, so it doesn't have the same hazards as X-ray radiation. And I think most people know that that's very hazardous. You want to be careful. You have to wear lead aprons and stuff like that. But the hazards of laser energy also make it very serious in terms of safety. It's just that you don't have to worry about cancer development with overexposure like you do with ionizing radiation or, overexposure to the sun, for instance. They are classified as class 4 devices, and that makes them and sets them apart from all the other energy-based devices that we use in surgery.
So, Richard, what are some of the common hazards that you run across in the operating room, and how do you mitigate them? What are the common procedures you need to take in order to ensure the safety of the patients and the personnel in the room?
Yeah, the main hazards are, first and foremost, eye injury, because eye injuries, your eyes are so vulnerable to accidental light interaction, and they can become easily injured. So that's a primary hazard to look out for. Fires, they can ignite combustible materials very easily. Burns to the skin and other non-target areas of the patient and the staff. And then the electrical components of these devices are also seriously hazardous, far more than all the other electrical devices we're using in surgery. And so that's where training is required. Because of the class 4 nature of these devices, training is required not only for the operators of the devices, but specifically for the users, the people that are applying it to the patients. And there's a lot of things that we have to account for. And again, eyewear, the proper eyewear with the right optical density factor and a lot of things like that. There's some technicalities to it. There's smoke evacuation. We're generating plumes that have bioaerosols and other components in there, intact strands of DNA and mitochondria that are thought to transmit pathology. So, along those lines, we have to protect against, the fires, the burns, the ocular injuries, and then those non-beam hazards, which are the smoke plumes and things like that are generated during laser applications.
So just one follow-up question on that. The smoke plumes, how are those addressed in the OR with the laser? I know how they're doing it with electrocautery right now, but is there a special evacuation tool that you're using with lasers now?
Yeah, absolutely. Yeah, you cannot rely on a high filtration breathing mask, for instance, which, we still like to wear them, but they're not protecting you really. The smoke evacuator, the local plume exhaust device is really what our first and best defense is. So we want to make sure that we have, a smoke evacuator device, either a mobile unit or one that's installed in the room with the proper 0.1 micron opal level filtration to make sure we're capturing all those very tiny, small particles that are found in the laser plume. And we have to make sure that the filter is good. We have to make sure that it's running. We have to make sure that the inlet nozzle is kept close to the target zone where the plume has been generated, so we capture all that smoke. So that is really, really important. And, we still have compliance issues in the industry. We have states that are now legislating smoke evacuators because physicians and others are hesitant to use them because of the noise. They have rationale why. But, it's always been a big problem in the industry. Standard wall suction does not do it. It does not capture all the smoke that's generated in a lot of the surgical procedures in particular that we do. And certainly it's not rated for the particle plume capture that we're looking for. So yeah, smoke evacuators are the first and best line of defense.
So I don't know what statistics you may have or what specific numbers you may or may not have, but when you think about exposure to viruses like HPV and laser plume, do you have any numbers or any information on that for people who are being exposed to that in their laser cases?
Well, I can tell you, if you're doing those kind of cases like condyloma ablation, yeah, you're absolutely getting that HPV in the smoke plume. And if you don't know, and I don't have a lot of statistics on that, there are studies and this, that, and the other thing, but what I can tell you is, I treat everybody just like I would blood-borne pathogens concerns, right? We don't know what people are diagnosed with or what they have, or even what they have that they're not diagnosed with, but we know that these things can exist. So we always want to treat the plume from any patient for any procedure, the same way we would if we knew they had all those, nasty little diseases that we don't want to catch.
So I've got another question, Richard. I do consulting in the OR, and generally one of the first questions I ask on the first day is whether or not they have a laser safety officer for the hospital. But I get a lot of different answers on this. Sometimes they say, well, the technician that comes in acts as our laser safety officer with the rental unit, or head of biomed as our laser safety officer. The question I have is those people, well, number one, I'm not sure that the technician in the room should be the one for the hospital that's the LSO. And also, number two, the biomed person probably never goes into the operating room to see whether or not safety measures are actually being taken. So what is your recommendation in terms of who should be a laser safety officer in the hospital, in the operating room?
Yeah, well, you're absolutely right. There's all kinds of what I would call misinformation out there about that person and their position. I mean, look, the standard says that they have the knowledge, background, experience to administer a laser safety program. And oftentimes we find, like with some of the groups that you mentioned, like biomed, they don't have that surgical experience or that patient treatment experience. But look, I mean, having people get involved is tough. A lot of people don't. These are often additional responsibilities they're taking on into the regular stuff that they do day to day. So a lot of times we find these people in these positions, they're what we call voluntold. They have to be dragged into it. And, and sometimes people think it has to be a medical doctor because we're called medical laser safety officers, and that's not true either. Look, the bottom line is we've been contributing to this false narrative for quite some time. In fact, back when I started at 89, like I mentioned, there was no healthcare standard. There wasn't the Z136.3 standard. And we were told a lot of stuff by the manufacturers. That was basically where we're getting our information from. And we were actually would say that as a third-party provider of rental service. Yeah, we act as your laser safety officer. We hang the signs. We bring the glasses. That's what we thought, being a laser safety officer was. But obviously that's not what it is. We actually are trying to dispel that myth and rumor in the industry now. And we certainly don't want to advocate that, people rely on their third-party laser vendor to act as that laser safety officer. So that person really comes best from an experience and background, typically in the OR or treatment environment. And that way they can really better know and anticipate and analyze the hazards and the safety procedures and things like that need to be implemented. But yeah, there is no such thing as a laser safety officer by virtue of the fact that you bring a laser in and you hang the signs and operate the laser. That's just a false myth. And by the way, the standard says, and, accreditation standards and workplace safety OSHA standards, they all say whether you own, rent, or borrow a laser system for patient care, you must have a laser safety program and you must designate a medical laser safety officer.
That's very interesting. My experience with the laser safety officer at the first OR that I worked at was just a scrub tech his name was written on paper and he passed out a laser safety test every year that we all shared the answers to. And that counted as our laser safety education. And he was in ortho, but I don't think he ever was in a laser case either. I mean, he just was, his name was on paper. So not exactly up to the standards, I don't think.
Yeah, and unfortunately we see, kind of a lot of that. But I mean, look, the bottom line is they must have training from a reputable training source in order to learn how to be a medical laser safety officer and to administer the laser safety program. So, and again, not anybody, but, certainly a surgical tech, we see that, nurses, we see physicians, we see biomeds, we see x-ray, people that are involved in the radiation safety program of the hospital become the medical laser safety officer because of the radiation connection. But the bottom line is that person has to have to be trained, as a medical laser safety officer, know all the ins and outs, in that capacity. And then, come up in the facility, and hopefully that might even involve a committee. But you got to realize the standard is designed to cover all aspects of healthcare, not just the operating room where, the acute care environment. So technically, a physician who owns their own laser and uses it in their clinic could be the laser safety officer for their clinic, and they could operate that laser during their treatments where they actually are the laser user, right? But in the acute care facility, like, we operate in the operating rooms and things like that, you have a patient under anesthesia, you've got other kinds of equipment, you've got sterile environments. And then if you're having a nurse or a tech operate the laser, they've got competing responsibilities. So now you've got a conflict there. So it gets a lot more involved when you start talking about the acute care facilities, and some of these bigger operating rooms where, we have all these other dynamics going on.
One of the things that I've seen over the years is in trying to send people to these medical laser safety officer programs. Number one, they're kind of expensive. Number two, they aren't typically regional. You have to travel to get to them. And, again, more expense. And so some hospitals are a little bit leery to do that. But, I totally agree with what you're saying in terms of getting people trained properly. I do have another question though. In some facilities, what I've recommended is that the medical laser safety officer report to the radiation safety committee. So they would go and report to, the same people that are looking at the radiology department and so forth. Is that the proper approach? I mean, is that where they should go, or is there somewhere else they should report to?
Well, no, that's a great marriage, right? They're both radiation producing devices in terms of ionizing versus non-ionizing, X-ray versus laser. So that's definitely a good fit, but that doesn't mean, that has to be exclusive. But, we see other people that should be involved, whether the committee emanates from, radiation safety or not, the risk manager, and things, people of that nature, even, maybe even supply chain, to make sure that when they're buying new products or accessories, that those go through the right channels and, they get brought into the system properly. So that way you just don't have people bringing in laser products and devices, for trial and error. So, and again, a lot of this depends on the facility itself, the scope of their program, the nature of what they're doing. And again, a lot of facilities may not have that elaborate of a system where they have a radiation compliance and safety committee and stuff like that. But certainly that would be, one of the best, like I said, marriages to have with the program and the organization of the committees.
So we're talking about, or we've talked about ANSI, but what about the Joint Commission? What about OSHA? Like, obviously our industry is governed by multiple different either regulatory bodies or, professional trade organizations or standards and guidelines. How does all that play in? Because I've seen sometimes where you get one standard and it contradicts another one, and then the facility is kind of stuck with, okay, we follow this one for this reason, and as long as they do that, they seem to be in the clear. How does that all line up?
Well, look, I mean, you're right. There's all kinds of different professional organizations and, other position statements that are out there from all kinds of different professional organizations. But look, the main important ones, obviously the ANSI standard, and for the safe use of lasers in healthcare, that is the Z136.3 standard. But we also have to be mindful that, I've had a lot of directors too. Don't worry about the standard. It's not regulatory. Yeah. But what they forget is that the accreditation agencies, including Joint Commission, who are basically there, to make sure you're doing things properly so you can do business with CMS, right? The Center for Medicaid Services and Medicare Services. And also OSHA, right? Under the OSHA, Act of 1970 are concerned with workplace safety. So both of those really important organizations, and obviously OSHA being regulatory, they can come in and fine you and do all kinds of other things. Joint Commission and accreditation can prevent you from billing and getting paid for services. So those are two really important organizations and, regulatory standards that are driven by the ANSI standard.
So when you and I were talking prior to this interview, we talked on the phone, and one of the things that we talked about was the consistency of laser safety education, either for staff, but also for physicians. And there's a big difference because facilities mandate staff education frequency, or they follow standards for yearly education. But sometimes physicians aren't necessarily trained, or their training isn't mandated to be continued. Can you expound on the training problems we see in the industry?
Yeah, I mean, it is a big problem, because there's just a lot of credible sources that are hard to find and hard to get to. I mean, when you buy a laser, that manufacturer is going to send their reps in there, and they're going to provide some training, and they're going to do some laser safety for your staff, and they're going to do some laser training with the operators and with the users. But eventually that's going to go away. They're going to move on. And then you're stuck, trying to fend for yourself or recruit others. So, obviously, having, strong people in place with good training who know what the requirements are. And for the staff, right, it's just like radiation safety or bloodborne pathogens training. Because their jobs, their roles put them in the same room with these hazards, they have to be trained on it, and they have to be trained annually. So again, they don't have to learn all the laser physics and safety stuff that operators and users learn, but they have to know the hazards of what they're working around and the safety precautions that they need to implement to keep themselves safe and others safe. And they want to know how to take care of the patient and provide for their safety as well. So yeah, it's tough. Obviously, like in our position, we have a lot of highly trained people. We create training curriculums for our own staff. We have a lot of different avenues that we get information from, including from the manufacturers and surgeons and physicians and stuff. But the point is, when it comes to the staff, they're required to get laser safety and servicing every year. And you can lean on your third-party provider if you use a rental company, if they have that sort of resource for you. And then for the laser operators and the laser users, again, you want to try to get your OEM partners to fill those gaps as much as they can. But again, eventually those sources are just going to run away. And so you're left really to rely on your own program in a lot of ways, or find partners like Agiliti, to work with you, which is what we do for our customers. By the way, I didn't mention earlier, but, in terms of the medical laser safety officer training, we got involved with Laser Institute America to help raise awareness, to help raise the level, because we have a lot of customers, with surveys and everything else like that. We know they had gaps. So we actually worked in a partnership with them just to raise awareness, provide a better training. We bring a laser device in, we do hands-on. We can provide a $200 discount off that training, not just for the live courses, but they also have computer-based training as well. So we can, help bridge that gap for people who, have budget problems. And that's just a fact of life these days. But the operator and the user training is required at least at a minimum of every 5 years. They need to get retraining. You'd be amazed at how many physicians and even operators I ask, well, what's that laser you're using? And, they can't tell me what the wavelength is. If you don't know what the wavelength is, you don't know what the specific hazards are in terms of, eye safety and all these other kind of things. So training is really still something that's so important. It is very difficult to find really good, credible training. And of course, getting it into the budgets, is another thing that has been tough over the years on the healthcare facilities.
I have a question about credentialing the physicians. I see in some organizations where the physician will get credentialed to operate a laser, and it doesn't specify wavelength. And that's one of the things I've always pushed is if you're going to credential them for a laser, it's got to be laser specific. And the other piece of that is, like you were just saying, the timeline for how frequently you have to repeat the training in order to stay current and competent. And I never see that in the credentialing.
Yeah, no, that's a great point. And that's been one of my little things I've been diving into the last few years, right? Targeting the users. They're the ones that have it and applying the laser to the patients. And typically they're the ones that are causing some of the problems that we see happening in the operating rooms. But to your point on credentialing, and this is something that's really critical and important. And whenever I ask the question too, I do get, let down a lot by the fact that people don't know what's going on in their physician world of credentialing. Number one, they need to be not only by wavelength, but by device that they are using and the applications that they're using that device for. And the standard is very clear about that. And the reason is because you have different areas of the body that present different hazards, or what I call risk factors. So I actually wrote a paper and presented this at International Laser Safety Conference, but the hazards of laser use are static. Right? Those hazards don't change. You always have eye injury, burns, fire, and stuff like that. But the risk factors do change depending for the patient and for bad things happening depending on where you're operating. In other words, if you're in the airway around an endotracheal tube versus, on the skin somewhere, you have different risk factors associated with those procedures. So it's really important that not only the laser operators know what to have and be prepared for when the surgeon comes in and the laser user starts using the laser, but there are different risk factors associated. And then when it comes to the devices, right, you made a great point there. Oh, they don't even know what the wavelength is. But even if they are familiar with the wavelength, but they're employing different devices or different OEM, let's say carbon dioxide lasers, and there's some stuff that has happened in the industries well documented, with the death and stuff like that, because the surgeon had been credentialed to use a traditional CO2 laser. Then they got this fancy new fiber optic laser that uses gas purge to deliver fiber optic energy with CO2 because you can't use glass. It won't transmit through CO2. So they use high pressure helium. While the surgeon, they just let them have at it. And because the high pressure helium coming out of that fiber optic is capable of causing a gas embolism, that's exactly what he did. So the patient expired because of a gas embolism, and a lot of people were found and had administrative penalties, lawsuits, and everything else like that because they didn't credential the physician. The physician was not trained on that device.
Wow. Well, you know what? That brings us to quality. I can't think of a better segue as we talk about indicators. And all the time now, in just about every single conversation that I've been getting into with supply chain, especially as they write contracts for services, I hear KPIs, because it's all this value-based purchasing model now. So they don't want to know, because they're letting go of lowest cost, lowest price, line item savings, because they're letting go of that and moving towards, value-based purchasing. Now they need to know that it's performing and that the quality is there. Not only, the quality is there for the clinicians as well as the contract performs the way they expect it to in supply chain, but those are working hand in hand with a clinically integrated supply chain. So KPIs over and over and over. But the problem is it's really the clinicians and even sometimes the suppliers themselves that are the experts, because they know this very specific niche versus, all the things that go into surgery, right? And so what are some KPIs or quality indicators that can be used for measurement and then say, okay, we need to improve this program, or here's where we need to improve the safety program?
Yeah, no, that's a great question, a great point, because, actually accreditation, in those environmental care standards and whatnot, that kind of stuff is really important to continuous performance improvement, which they demand. And so if you don't have a system in place where you can not only have a reporting of those and develop your quality indicator metrics, but you have to have a system of reporting and resolution on those things. And that way you have a way to measure your quality. You have a way to look for areas for improvement, and you can actually act on those things. So yeah, like the ones that we developed, obviously are important for safety, but also for our services, right? So eye safety compliance is a really important one. We have a lot of gaps in compliance, and we need strong laser safety officers in these facilities. When the doctor says, "Oh, I don't wear eyewear," don't worry about it. You don't need to wear eyewear either. Especially when the hospital's own policy says, no, you have to wear the eyewear if you're in the room. You should be measuring that, right? So I think eye safety and eye protective compliance should be a quality indicator that everybody in the country is looking at, so we can make sure to keep people's vision safe. But other things like malfunctions or error codes of your laser systems, injuries or near miss injuries, fiber optic issues or defects, things like that. So even training issues, it could be a quality indicator. And again, we like that one as well, not only from, a facility staff standpoint or user standpoint, but from our own employees. If we have somebody out there who somehow slipped through the cracks and is not as knowledgeable as we expect them to be, we want to know that and have it reported. So I think those are some really important ones. And again, healthcare facilities need to look at their own programs, look at the scope of use of lasers, how many different lasers are they using, and develop their quality metrics based on their specific areas of use and what specialties they're working in, how many different departments they have lasers in, and things like that. And the other thing I would throw in there, really important quality indicator measurement, would be their inventory and their preventive maintenance. Are they certain that they have all their lasers up to par when it comes to calibration and electrical safety and things like that? So those are a few really good ones to focus on. But again, I would encourage them to really look at their own programs. What kind of procedures are they doing? What kind of lasers do they have? And start, from there.
All right. Last question here. Oh, sorry, Melanie. Go ahead.
No, go ahead.
No, you got it.
Yeah, it sounded like she was going to say, that's great, Richard.
I was. Because, those were all really good suggestions, and bringing it back down to at the facility level, paying attention to what do you have? A pre-printed list off the internet, it might not just work for your facility because you might have different types of lasers doing different types of procedures. So remembering to make it facility specific while following the guidelines and the standards is like the best advice ever. But one thing you mentioned in the quality indicators was compliance with eyewear. And compliance is a big thing. And when it comes to all of our operating rooms around the country, but how could we improve the facility and industry compliance with laser safety?
Well, I think training and education is the big start, right? If people don't understand the risks that they're facing and then they get disinformation from a surgeon who just doesn't like to wear the eyewear for one reason or another. And by the way, those surgeons are the ones that are typically at the highest risk for eye injury because they're closest to the emitting aperture of the device. Not only that, they're the ones causing some of the breakage and the common areas where fibers crack at the scope and stuff. It's right in front of their face. So if anybody should be wearing eyewear, it's the physician, but typically and all too commonly, they're the ones that are discouraging use, poo-hooing the importance of it, and then the staff follows. Well, if the surgeon isn't wearing it, why should I wear it? So I think training and education is really a big part of that. And setting standards. It's not enough to have a policy. You have to have enforcement of the policy, and you have to have buy-in. You have to have a culture of safety. And if you don't have that, that's why we see all these compliance gaps. And something as basic as eye safety is really critical. Again, earlier I said your eyes are the most vulnerable part of your body to becoming injured. And, if your eye gets injured, particularly your retina, but even if it's just your cornea, you're going to have visual impairment. And depending on the severity, you could lose vision or other things. So, we hear the term retinal safe being thrown around as why they don't have to wear eyewear if they're, working with a infrared laser that's absorbed by water that's going to not go through their cornea, for instance. You can still sustain corneal injuries with these devices. So, that's a really important thing is training and education, but also monitoring and enforcing your policies. Because I guarantee you these hospitals have policies in place. They're just not being followed and enforced.
Well, compliance is so key, and always having a good snapshot of where you're at, where you're going as an organization. It sounds to me like, and we'll kind of close on this, Richard, but it sounds to me like once you have turnover and your laser safety officer, the whole thing could just fall apart and you could start from scratch again. Is that a common occurrence out there?
Yeah, actually it is. And I can't give you a specific number, but I can just tell you, throughout my career and my job, I come across that a lot. In fact, some of the famous lawsuits that we've studied and things like that were exactly in that scenario. Well, they used to have a program and a long-standing medical laser safety officer. That person left. They didn't have him replaced. And then lo and behold, things just start unraveling when it comes to following the policies they established and the ANSI standard guidelines, particularly in the airway. It's really important that those things get addressed from a quality standard, right? Have those quality indicators, take a look at them, measure them, look for areas of improvement. But by gosh, I mean, if you're not monitoring and making sure the laser users, those treatment providers and surgeons are properly credentialed on the devices that they're using, the wavelengths, and the applications that they're using on, because again, remember, the risk factors vary from body place to body place. And some of those risk factors, like in the airway, can potentially be lethal for patients when things go bad. And that has happened. So, again, we want to make sure that we have training and education for everybody. We want to make sure that we have current. In fact, when I review some of our customers and others policies, they're basing their policies off old, outdated standards. I read one a couple of years ago. It was based on the 05 standard. And that's 2 standard removes from the current standard. So the current, just like CPR standards, right? Those things change and evolve over time. And so you've got to stay on top of that. And that's why retraining is so important, not only for the laser users and the laser operators, but for those medical laser safety officers as well.
All right, Richard, I got to tell you, this was an absolutely fantastic, phenomenal interview.
Well, thank you.
Yeah, no, just packed with a lot of great information, and clearly information that the audience needs to hear and needs to share within their organizations. So I can't thank you enough for coming on and sharing your insights, and looking forward. I feel like we could definitely have you back in a future season and kind of continue the conversation, but maybe chunk out a very specific area and dissect it for everyone and really grow this knowledge base. So thanks for coming on.
Hey, it's my pleasure. I'm really happy to be here. I'm really happy for the opportunity, and always happy to talk about laser safety and healthcare and try to, raise the level out there for the betterment of our entire healthcare community. So patients and staff deserve the best, and that's where we're aiming to go.
That was Richard Gama, Director of Laser Safety at Agiliti. And what an important topic, Melanie. And I know when we first got kicked off with the interview, we were talking about how this is important not only for patient safety, but also for employee safety. And I think Richard really hit that home towards the end of the interview, talking about, no more risk for anybody on the team than the surgeon themselves.
Oh, absolutely. And I hadn't even really thought about it until he really broke it down. They're right there by it all, and you think about the surgeons not wearing the eyewear, or, and then other people in the room don't wear it because the surgeon doesn't wear it, and all the misconceptions around whether or not you even have to wear it. But just the risk to all of us in the room, along with the risk to the patient. He just really did a good job explaining all of that. And I learned a lot just sitting here listening to him.
Well done, Richard. Great interview. But that's going to do it for this week's show. As a reminder, you can help support First Case by subscribing on Apple, Amazon, or Google Podcasts. You can also find us on Stitcher, iHeartRadio, Spotify, or search for First Case on your favorite podcast application. We've also got bonus content, and that's only for certain episodes, but to access it, you have to download our smartphone app for iPhone and Android. We'd certainly appreciate a rating and a review, because your feedback is important to the show. And on behalf of Paul, Melanie, and myself, thank you for listening to this week's episode of First Case.